We are going to talk about schizophrenia. That can sound big and scary, I know. Our goal is to make it less scary. Replace fear with facts. Replace confusion with clarity. Schizophrenia is a health condition that affects the brain. It changes how a person thinks. It changes how they feel. It changes how they interact with the world. It is not a character flaw. It is not a choice. It is a medical illness like diabetes or heart disease. It deserves our compassion and understanding. Imagine your brain as a complex radio tuning into signals. For someone with schizophrenia, that radio sometimes gets its signals crossed. They might hear things that are not there. They might see things that are not there. They may find it hard to connect thoughts in a straight line. That can make it hard to tell what is real. It can be confusing and isolating. But here is the most important thing. There is help. There is also hope. With the right support and treatment, many lead fulfilling, meaningful lives. Knowledge builds bridges. Understanding helps us be better friends. It helps us be better family members. It helps us be better community members. We can dispel harmful myths that cause pain and stigma. We can create safety so people ask for help instead of suffering in silence. Today we will walk through this topic step by step, with kindness and respect. We will look at the signs, how doctors diagnose it, and the real treatments making a difference. So, where does schizophrenia come from? This is a question that scientists and doctors have been working on for a very long time. The simple truth is, there is no single, easy answer. It is not like catching a cold where you can point to one specific germ. Instead, it seems to be a combination of different factors all coming together. Think of it like baking a very complicated cake. You need several ingredients. For schizophrenia, the main ingredients include genetics, brain chemistry and structure, environmental factors. It is a complex recipe, different for everyone. Let's start with genetics. It can run in families. There is some truth to that. Close relatives, like a parent or sibling, increase your risk. But, and this is a very big but, it is not a guarantee. Most people with a family member affected will not develop it. Many diagnosed have no family history at all. Genes are part of the story, not the whole. They can increase vulnerability. Next, brain chemistry and structure. Brains use neurotransmitters to send messages. Dopamine, glutamate. In schizophrenia, these systems can be out of balance, like the volume being too high or too low on certain signals. Scans can sometimes show subtle structural differences. These are deep differences in the brain's wiring. Finally, environmental factors. Life events that influence health. For someone genetically vulnerable, events can trigger illness, stress, trauma, especially early in life. Complications during pregnancy or birth. Infection, malnutrition, mind-altering drugs, especially during the teenage years and early adulthood when the brain is still developing. These drugs can sometimes trigger a first episode of psychosis in susceptible people. It's the combination, genes, brain, and life experiences, that makes the full picture. Genes, brain, life experiences, a combined network. Now that we have an idea of the causes, let's talk about what schizophrenia can actually look like. The symptoms are often grouped into three main categories. Think of them this way: positive, negative, and cognitive symptoms. The word positive here does not mean good. It means symptoms that are added to a person's experience. Negative does not mean bad, but symptoms that involve something being taken away from a person's usual abilities. And cognitive symptoms are the ones that affect a person's thinking. These symptoms can appear gradually over time or sometimes show up quite suddenly. First, let's look at the positive symptoms. These are often the most well-known signs of schizophrenia. They include hallucinations, which is when someone sees things that no one else does, hears things that no one else does. Hearing voices is the most common type of hallucination. Smells things that no one else does, or feels things that no one else does. Another positive symptom is delusions. strong beliefs not based in reality and not changed by evidence. For example, someone might believe that they are being followed or that they have special powers. A third sign is disorganized thinking and speech, where a person may have trouble organizing their thoughts, jumping from one topic to another in a way that is hard to follow. Next are the negative symptoms. These can be harder to spot because they might be mistaken for laziness or depression. They represent a loss of normal functions. A person might show a flat affect, where their face does not show much emotion, or they speak in a dull, monotonous voice. They might experience a loss of pleasure in everyday life, where things they used to enjoy no longer bring them joy. Another negative symptom is a lack of motivation, or a withdrawal from social life. They might stop making plans with friends, neglect their personal hygiene, or find it incredibly difficult to start and finish even simple tasks. These symptoms can be deeply disabling and have a huge impact on a person's ability to function. Finally, we have the cognitive symptoms. These are more subtle, but they can be just as challenging. They affect a person's memory and their ability to think clearly. Someone might have trouble with executive functioning. So, if someone is experiencing these symptoms, how do doctors figure out if it is schizophrenia? It is a very careful and thorough process. There is no single blood test or brain scan that can say, yes, this is it. Instead, a diagnosis is made by a trained mental health professional, like a psychiatrist, who gathers a lot of information from different sources. It's like being a detective, piecing together clues for a full picture. The main goal is to understand the person's unique experience and make sure no other medical or mental condition is causing the symptoms. The first step is always a conversation. A doctor will sit down and talk calmly and non-judgmentally. They will ask about the person's thoughts, feelings, and experiences. They'll ask when the symptoms started, how often they happen, and how they're affecting daily life, work, school, relationships. They'll ask about family health history and mental health conditions. This interview helps the doctor see the world from the patient's view and builds trust. After the conversation, the doctor rules out other causes. Medical issues like a brain tumor or a thyroid problem can affect thinking. Street drugs like methamphetamines or LSD and prescription medication side effects can mimic psychosis. Doctors may order a physical exam, blood tests, or a urine drug screen. They may suggest a brain scan, an MRI or a CT scan, not to diagnose schizophrenia, but to check for other brain problems. Once other causes are ruled out, doctors compare symptoms to official criteria. Many professionals use the DSM-5. It lists symptoms such as delusions, hallucinations, and disorganized speech. It also requires symptoms to last at least 6 months and to cause serious problems in major life areas, work, self-care, or social interactions. Once a diagnosis is made, the next question is, what can be done to help? This is where the hopeful part of the story really begins. While there is no cure for schizophrenia, there are many effective treatments that can help people manage symptoms, prevent relapses, and live full, productive lives. Treatment is not a one-size-fits-all approach. It is usually a combination of strategies tailored to the individual's needs, and it often involves a team of dedicated professionals. The most common and effective treatments are medication, psychotherapy, and coordinated specialty care. The cornerstone of treatment is typically antipsychotic medication. These medicines help rebalance brain chemicals, especially dopamine. This can reduce positive symptoms or make them go away, hallucinations, delusions, and help a person think more clearly. Like any medication, they can have side effects, drowsiness, weight gain, restlessness. That is why it is so important to work closely with a doctor. The goal is the right medicine and dose with the fewest side effects. It can take some trial and error, but these medications are vital for recovery. Psychotherapy or talk therapy is also incredibly helpful. One type of therapy that works well is cognitive behavioral therapy, CBT. This helps people identify troubling thoughts and test the reality of them. It does not remove symptoms, but it builds coping strategies so symptoms cause less distress. Family therapy is another powerful tool. It helps family members learn about the illness, improve communication, and find better ways to support their loved one, reducing stress for everyone. Therapy offers a safe space and practical skills for daily life. The best approach for a first episode is often Coordinated Specialty Care, CSC. This wraparound program includes medication management, psychotherapy, family education and support, help with work, school, and help with life skills, managing money, learning to cook. People need more than a prescription. They need support across life to get back on their feet. Early and sustained treatment is key. The sooner someone gets comprehensive help, the better their chances for long-term recovery. When someone is living with schizophrenia, the support of family and friends can make all the difference in the world. It is like having a steady, caring crew on a ship, navigating a sometimes stormy sea. Having this circle of support helps a person feel less isolated and more hopeful about their recovery journey. However, it is not always easy to know how to help. The most important thing you can offer is your patience, your love, and your willingness to listen without judgment. Encourage and assist with treatment. Help them remember to take medication every day. Offer to drive to therapy or doctor visits. Be an extra set of eyes and ears for the team. With your loved one's permission, share observations, what helps, and if new symptoms appear. Collaboration ensures responsive care. Educating yourself is a powerful act of love. The more you learn, the more you'll understand their experience. Learn to separate myths from facts. Negative symptoms like low motivation are part of the illness, not laziness. Finally, take care of yourself. You cannot pour from an empty cup. We have covered a lot of ground today, walking through the complexities of schizophrenia with a focus on clarity and compassion. We have learned that it is a treatable medical condition of the brain, not a personal failing. We have looked at its roots in genetics, brain chemistry. We demystified its symptoms and outlined the careful steps doctors take for diagnosis. Most importantly, there are effective treatments, medication, therapy, strong support systems that offer real, tangible hope for recovery. The old dark myths are fading, replaced by science and empathy. The journey is a marathon, not a sprint. There will be good days and challenging days. Improvement is possible, and a meaningful life is within reach. If you are worried, reach out. Do not wait. Talk to a family doctor, a school counselor, or a community mental health center. NIMH and NAMI offer reliable information and helplines.